Now, vaccinations continue across the state today, and soon those at long-term care facilities will be able to get their first doses.
Dallas Ontiveros is in Hawaii Kai right now and joins us live with more.
Good morning, Ross and Kelly. That's right. You've been watching Wake Up Today throughout the entire morning and Take Two, hearing from residents and also employees here at Hawaii Kai Retirement Community, where they are going to be having their vaccinations next week, January 7th and 8th. That's next Thursday and Friday, done through a partnership with Longs, where employees and also residents will receive the Moderna vaccine. But to give us more insight about everything going on here, we have Adam Dolak, who is the general manager. Good morning. Aloha.
Aloha, good morning. How are you?
I've been doing great. It's been such an active morning, just talking to different residents, really just picking their brain about, the vaccines coming next week. It's such a big step in this whole experience. But I want to ask you, for anyone who chooses not to take the vaccine, whether they are an employee or a resident, how does that protocol work out?
Sure. Yeah, we are adamant that the vaccination program is voluntary for everyone. While we believe in the vaccine and we are excited about the opportunities that it brings, we understand that there are going to be many residents and many employees that want to wait and see or have some legitimate reason where they feel that it's not the right thing for them. For those folks, there is going to be a form that they sign just acknowledging that it was offered to them and they've chosen to decline at this time. Other than that, there'll be no change to anything. Everybody will continue kind of operation as normal.
And I don't know if it's too far to look into it as far as 2021 goes, once the vaccinations happen, because care facilities are going to be one of the first who really get the vaccine. Are any rules going to change when it comes to family visitations or friends or just the layout of everything here?
At this time, Dallas, we are holding on to all of the protocols. It's a little early to kind of make those decisions about how things can change based on the vaccination program. I think even the CDC is saying the vaccine, until we can get a broad enough population vaccinated, it's not a silver bullet or anything, right? We have to make sure that we still follow our protocols, wear our masks, wash our hands, maintain safe distances as much as possible. So for us, the protocols will remain the same even post-vaccination. It just adds another layer of protection for the residents so that they can feel that much safer and lose that sense of fear that some of them have had during the pandemic.
That's good to know. And I want to ask you, not only this year, but in the future, how did you all handle new cases or little outbreaks throughout this year or in the future?
Yeah, so, as we've had the virus going on, our protocols have constantly evolved, right? We did go into, for a long period of time, a proactive isolation from the rest of the community outside of our four walls. And we realized that that was fantastic, but it also may have gone a little too far. So we slowly roll some of that back over the last year so that we had some interaction. One or two family members could come visit residents in their apartment without, using the common areas. Residents could get on the bus and go down to the shopping center and, have a little bit more of that type of interaction. When there is an active case in the community, which we've only had a handful over the course of the whole year, we do go into a slightly more cautious phase where we are asking people to not enter the property and not exit the property just for a couple of days so that we can ensure that there is no spreading of the virus. And we've been very successful with that we haven't had any large spread or outbreaks. It's always been just a handful, one or two, 4 was the most at any given time, and they've all been able to be isolated very nicely.
And as we get into next week, January 7th and 8th, that's the day of the vaccinations take place. How is that going to work out? Is that going to be done in the morning, sometime in the afternoon?
Yeah, so it'll be an actual all-day process for 2 days. When you think of, we have 280 or so residents, about 160 employees on this property. We are the largest facility in the state. So,
And one of the first to receive
yes,
it too.
yeah. So it's going to take 2 days to get everybody vaccinated that wants to. We're estimating the number of people that are choosing to get vaccinated somewhere between 250 and 300 at this point. That number changes daily as people change their mind. People feel more confident. They're adding on to the list. So we do expect it to be 2 full days with Longs on site, with multiple pharmacists issuing the vaccine.
All right, Adam. Well, it sounds like the pieces are coming together
Yeah.
for a better future. I really hope that we could be here next Thursday and Friday to capture the history. But I want to thank you so much for grabbing all the residents for us and really giving us some great perspective of what's going on here. We
Absolutely.
appreciate it.
We're thrilled to be one of the first to go and lead the way on this.
Thank you so much, Adam, for your time. We appreciate it.
Thank you, Dallas.
And if you want a recap of all the different interviews that we covered this morning and also what the timeline looks like for Hawaii Kai Retirement Community, you can check our website later today at KHWN2.com, where you can read more information. Reporting from the scene here, Dallas Navarros, KHWN2 News, working for Hawaii.
Thank you very much, Dallas, and great job out there this morning.